80 a.m., their staff, or management, but are strictly those of the hosts, guests, and callers.
N'attendez sous information tous les lundis sous 1580 AM et 99.5 FM à partir de 3h et tous les mardis et jeudis 10h AM. Gilbert, qui sont portés pour nous aujourd'hui en même?
Merci Guylaine. Non, moi c'est Gilbert Franklin. N'a salué tout le monde qui a nous aujourd'hui. Restez branchés, n'a porté toute information qui pourrait aider à avancer dans la vie.
Moi ta remè connaît date jou m'a mouri.
N'attendez sous information sorti lundi pour arriver vendredi sous 1580 AM 99.5 FM. Gilbert, qui ça ou poté pour nous aujourd'hui?
Merci Cynthia. Non, moi c'est Gilbert Franklin. Restez branchés, n'a porté information sur les affaires Medicare, Medicaid, Food Stamp, Social Security bénéfices avec un pilote bénéfice encore. Moi, c'est Gilbert Franklin. Si vous pouvez gagner 65 l'année ou plus et vous êtes dans Broward County, vous êtes capable de qualifier pour joindre une série de bénéfices qui aident pour ne pas payer les Walkai docteurs. Relais Gilbert Franklin dans 954 667 48 85. 954 667 48 85. Nous pouvons aider à joindre Medicare, Medicaid, Food Stamp, visite docteur pour examen yeux, dents, transportation, exercice, ak l'autre encore. Relais Gilbert Franklin dans 954 667 48 85. 954 667 48 85.
Mami, papi, ou c'est récipient Medicare. Ou t'as cherché une clinique sérieux, pas vrai? Râler 10 chaises, pas au vin goûter. Vivre santé, faut pas mettre pied n'importe côté. Joignez une clinique sérieux, t'as cherché juste pour couper. Inquiétez-vous, c'est une bonne nouvelle, moins potée. Zone suspend, casser tête, tout moins compte côté. Réponse là, c'est la santé, c'est celle priorité. C'est une famille qui pas nommer la guerre. C'est là, y'a traité avec dignité. C'est la maladie pas qu'à résister. Oui, relais Max Konya, dans 786 551 11 11, soit vive Mahamided. Mais mon Baod, relais dans 954 994 11 11. Problème subtension, cholestérol, prostate et la tria. Solution c'est. Dans Kemax, santé ou c'est priorité.
Ladies and gentlemen, welcome to the first English Sous Information.
Okay, I finally found what boosts my metabolism.
We would like to
and-
welcome you for this first edition. We will be talking about Medicare, Medicare Advantage Plan. We're going to cover everything you need to do or everything you need to know when it comes that time for you to retire. My name is Gilbert Franklin. You could reach me at 954-667-4885, 954-667-4885. We're also going to take questions live on air at for Miami-Dade 305. Just bear with me. That's 305-945-1580. For Miami-Dade 305-945-1580. And for you guys in Broward, I would like to hear from you also. It's 954-792-1580. So we're going to start first, right from the beginning. What is Medicare and how you can get Medicare and what makes you eligible? First of all, for you to be eligible for Medicare, well, let's start by what is Medicare? Medicare is a federal health program that was established under President Roosevelt. So they established it back then, and the way it works, every time that you work, they take 1.9% off your check. So that money is put on a reserve for you. to help you accumulate a certain amount of credit. So the amount of credit that you have to accumulate is 40 quarters. Now, how do you accumulate those quarters? Every year that you work, you could calculate it as 4 quarters that you've accumulated. Now, after you've accumulated 40 quarters, which equates to about 10 years of working. Now, if you're someone that's doing a couple of jobs, well, you're going to accumulate those 40 quarters well ahead of that 10 years. For example, let's say you're someone that's working 2 jobs and you're making equal amount of money in those 2 jobs. Well, you're going to be able to accumulate those 40 quarters in 5 years. Now, with Medicare there's a different part of Medicare. Once you accumulate the 40 quarters, and you could get Medicare at age 65, which is the age that you should be looking forward to, because 3 months before that, that's when you will be able to sign up for Medicare. Now, if you do not sign up for Medicare at the time that you're supposed to apply for it, well, then there's a penalty. The penalty equates to about 10% of your Social Security amount that you would be getting on a monthly basis. And there's no way of getting around that. There's no way whatsoever of getting around that, because that 10%, there's no way you could negotiate out of that. Now, so we're talking about the 10%. Medicare have different parts. Sorry for the lag. Medicare have different parts. You got Part A. Part A covers you for hospitalization. So everything that once you get in the hospital, whether it's that the first triage at the emergency room, whether they take your vitals. I want to break it down to the layman term. What I mean by vital, when you walk in the emergency room, you have a nurse that's going to check your blood pressure, that's going to check your temperature, that's going to check everything before they send you to see to the emergency room or see a doctor. So all that they do, once a doctor admits you into the hospital, so whether it's a lab work, whether it's they doing an EKG on you, everything that's being done, whether you've seen the doctor for a few minutes or a few seconds and the doctor disappears, you don't see him, whether the doctor is sitting behind a desk looking at your vital or looking at everything that the nurse put in, all that is taken care of for you. Your room, for example, your room is also into consideration. And your room is, whether you are sharing a room, whether you're in a private room, all that will be paid by the Part A of Medicare. So Part B itself is for doctors. Now, the Part B consists of your doctor's visit. And the best part about Part B, and we're going to get more involved into Part B in terms of, there's a course for each of them. Let's step back. Part A, for example, there's a course for it. Part B is $499 and change a month. But the fact that throughout the time that you are working, that 1.9% that they take from your paycheck, you no longer have to pay for the Part B, for the Part A, sorry. So a lot of people say, well, Part A is free. No, it's not free. Or even when you hear the politicians talking about Medicare is an entitlement program. No, it's not an entitlement program. is because that you have contributed into the system to pay for the Part A. That's why you're able to have it. So today, no one can take that Medicare from you because you've worked to attain that. You've worked to have the right to go see a doctor, to go to the hospital without having to pay anything because you have worked to get that to that point. So you don't see the cost for Part A because the Part A cost is already being taken from you. Now, the other aspect of it is the Part B. Part B is for doctor's visit. It covers doctor's visit. It covers your specialist visit. It covers DME. DME, for example, if you need a wheelchair, if you need a scooter, if you need a walker, all that is covered by the Part B of Medicare. Certain times you go to the doctor's office and they may have a medication that they want to prescribe while you're in the office. Well, the Part B is going to cover that particular medication. And sometimes you may walk out. When you walk out, the doctor may say that, well, you have a copayment for that particular medication that they administered in the office. And we're going to get into that because there's certain part that a Medicare and Medicare Advantage plan doesn't cover, then that's where Medicaid going to come in. And we'll go more into that as we get along through this program. Today, I wanted to dedicate most of this program to really cover what Medicare is. And in other programs, as you listen to us on a weekly basis, you'll become more familiar with the different benefits that you have available to you. Because of the simple fact that you've been working in the United States for a certain amount of times. Again, I would like to hear from you guys. You could call with your question on 305-945-1580, 305-945-1580, or 954-792-1580. We are doing this in English because we feel that there's a need for the English audience, whether it's in South Miami, whether it's in Broward or Palm Beach. There are a lot of people that maybe that's for the first time they listen to this station and have not, it really doesn't have a clue exactly what Medicare is. Most of us, we just, when we look at our pay stub and we see a bunch of deductions, for example. We see federal, we see, down here we don't see state. But other states, we see state, and we see Social Security, we see Medicare. And if you want an insurance, a health insurance through your employer, then you see those deductions there. Those deductions we know about, but the Medicare and the Social Security, I'm quite sure a lot of us really don't have a clue what that's all about. So that's what we're going to concentrate on. But, we would like to take your question live on air. 305-945-1580, 305-945-1580, or 954-792-1580. For Broward, 954-792-1580. So to continue with Medicare, so the Medicare aspect of it, the Part B, so we mentioned about you probably, if they administer medication at the office, Medicare is going to pay for a portion of Part B. Now, before we continue, if you have Medicare by itself, Medicare covers 80% of the bill, the 20% you become vulnerable to pay for that part. So that's why we suggested for you to always put a Medicare Advantage plan with it. The Medicare Advantage plan is going to cover a lot of things that Medicare does not cover. For example, Medicare does not cover dental. It does not cover hearing aid. And it does not cover eyes. So that's where they come, that's where the Medicare Advantage plan comes in, which is the Medicare Advantage plan is Part C in Medicare. So the Medicare Advantage plan basically cover all those things. They also have what we call added benefit. There's certain added benefit that Medicare has. For example, when you take over-the-counter medications, you take right now they have what they call a meal card. So you have a meal card, which the meal card helps you get, for example, go food shopping. But the type of food shopping that it provides, it allows you to purchase, it does not allow you to purchase pork. It does not allow you to purchase soda, because the goal of the health plan, and this is something that finally that they come to the realization, I would say this year, really. This year, they finally decided, well, you know, it's not a meal card. We're going to call it a healthy meal card. And when you get to the counter, if there's a soda there, they say, well, the soda, we're not paying for it. So that's one of the added benefit that they have there. Of course, from time to time, they have acupuncture. They have a lot of other stuff also. Let me take this break to thank CareMax Medical Centers for sponsoring this program. We'd like to say a good hello to the executive team there. And also Cladelia Management Services. So those are the two sponsors that we have that's sponsoring this program, that's allowing for you to get these information today. So to continue, the Medicare, it's by far, I think it's the best law that they had, the best the best law that they signed, the best bill that Congress and the president at the time signed and put it into law, because it concentrated on a wide range of people. And you know, later on we're going to get on different benefits. We're going to talk about Social Security in a while. I would like to take a break, and when we come back at the second half, we're going to discuss more about we'll get into more Medicare, and we'll get into a little bit about Social Security. You're listening to Source of Information, in Creole is Source Information, with Gilbert Franklin. We'll see you on the other side. À tout à l'heure, in a little while. Bye.
N'attendez sous information, sorti lundi pour arriver vendredi sous 1580 AM, 99.5 FM. Gilbert, qui ça ou pote pour nous aujourd'hui?
Merci Cynthia. Non, moi c'est Gilbert Franklin. Restez branché. N'apporte information sur les affaires Medicare, Medicaid, Food Stamp, Social Security bénéfices, avec un pilote bénéfice encore.
Mami, papi, ou c'est récipient Medicare. Ou t'as cherché une clinique sérieux, pas vrai? Râler 10 chaises, pas au vite goûter. Si vous voulez vivre en santé, faut pas mettre pied en n'importe côté. Joignez une clinique sérieux, t'as cherché juste sous vous couper. Pas inquiétez, c'est un bon kase tèt ou mwen kon kote repons la ye. Se la santé ou se sel priorité. Se yon fami ki pa nome la guerre. Se la yap traité ou avec dignité. Se la maladie pa ka résister. Oui, relé Max Konya dans 786 551 11 11 soit vive Mahamided. Mais moun Baod relé dans 954 994 11 11. Problème subtension, cholestérol, prostate et la tria. Solution c'est dans Kemax, santé ou c'est priorité.
Moi c'est Gilbert Franklin. Si vous pouvez gagner 65 l'année ou plus et vous restez dans Broward County, ou capable de qualifier pour joindre une série bénéfices cap aider pour pas payer les Walkai docteur. Relais Gilbert Franklin dans 954 667 48 85. 954 667 48 85. Nous ca aider au joindre Medicare, Medicaid, Food Stamp, visite docteur pour examen yeux, dents, transportation, exercice, ak l'autre encore. Relais Gilbert Franklin dans 954 667 48 85. 954 667 48 85.
All right, call. I'm waiting for your call still on 305 945 1580. 305 945 1580. Or Broward County, the phone number to call in is 954 792 1580. 954 792 1580. Let me hear from you guys. I'm really love to hear from your question. You could actually call. This is probably the only show that you could actually call live on air, ask question, and we will be taking your question live. So again, the number is 305-945 1580, 305-945 1580, or 954-792 1580, 954-792 1580. If you're looking for a home, for a medical center where you could receive care with heart, and not only that, at CareMax Medical Center, we have a vast majority of the specialists, and we have different centers throughout the United States. So you could go to, so whether you up north or you down here in South Florida, we have a home for you, and with transportation available to you, with dentists and optometrists and various specialties. That's right there in one location, and we have transportation that's available to you. One of the things that I take pride in seeing is that the transportation actually go get you from your home and bring you to the center for exercise. So in this show, one of the things that at the beginning of the year we had made a wish for you is that for you to have good health, prosperity, but we want you to have a good health that's a good quality of health. That's the word we're looking for. So the way we could assist you in doing that is provide you with the information. With the information, with the right plan to be in, would provide you with the medical aspect of on this show we talk about the medical part, how to do prevention, for example, how to the medication that you're taking, give you the right information, how to take it properly, and so that it could provide you with the best, really address your problem by you taking it properly. So please call right now, 954-792-1580, 954-792-1580, or 305-945-1580, 305-945-1580. Again, this is the first English version of this show, and so I definitely would like to hear your feedback on what you think. And of course, we want to continue to do that every Wednesday from 2 to 3 program. And the second half, we'll go into the Creole version, and that's the part. That's the time that we'll be talking more with Dr. Semilis with regarding. Today we're discussing cholesterol. So stay tuned. Don't go anywhere. And next we'll have Dr. Semilis with us talking about cholesterol and all that good stuff. All right. So to continue with Medicare. So we discussed about Part C, which is the Medicare Advantage Plan. Now let's discuss Medicare Advantage Plan a bit. Medicare Advantage Plan was created in California. So when they came with it, I don't recall the year, but I'll do more research to give you the exact year. But when they decided to come with Medicare Advantage Plan, well, down South Florida, we've managed to use that same plan, the same platform, and I think in South Florida we've perfected it, because at one point in South Florida it was very difficult. It was very few people that was in a Medicare Advantage Plan, because you had a group of people that was discouraging people to get into a Medicare Advantage Plan. And the reason they were actually discouraging you, because they were profiting in charging your Medicare. You see, in recent years, about 2 to 3 years now, they've changed that system, whereas your Medicare card no longer has your Social Security number in front of it with a letter A in the back of the Social Security number. So they have a group of letters and a few numbers. That's what they identify you with. So, and no, just anybody can just grab your Medicare card and start billing. Before they were able to bill your card, and next thing you know, Medicare is sending you not a bill, but send you a notice that this was billed to your Medicare. So now they're no longer able to do that. But the purpose of Medicare Advantage Plan is to serve as a safeguard, for lack of a better word, as a safeguard, so that no one have access to your Medicare and be able to bill just for any reason. Because anything that's being done has to go through your primary care. For example, if you need to see a psychiatrist, in certain cases, your Medicare, or maybe psychiatrist may not be a good example, because you may not need a referral for a psychiatrist. In most cases, that you could call the psychiatrist directly and schedule an appointment and see them, as long as they take your Medicare Advantage Plan. But for example, let's use another example. If you need a cardiologist, well, your doctor have to refer you to a cardiologist. They have to create a referral, and the referral, basically what it is a paper that the doctor send all the information of what the reason why you need to see the cardiologist, and send it to the insurance, the Medicare Advantage company. Then they have to approve it so that you're able to see this doctor. Now, the way I'm making it sound in English, it may sound complicated. It's not all that complicated, because us at CareMax Medical Center, all that is created for you. All that is done for you. Basically, the only thing that you really have to do is, in the morning, get up and wait for transportation to pick you up, and then you go see a cardiologist. In our cases, the cardiologist is in the office. So transportation will bring you in the office for you to see the cardiologist. Now, is that the same thing for HV specialists you've seen? Yes. And later on, we'll go into the different plans, and because right now there's PPOs, there's different plans. We'll get into it more, but we want to stick to the basic of what a Medicare is. So with the Medicare Advantage Plan, it basically controls all the medical part of your Medicare. The bills, it takes care of the bills. They'll get the bill if you're in a hospital or for a doctor's visit or what have you, they'll get the bill, they'll pay it. So basically, you have no clue of what's going on. All that is being taken care of for you. The other part that's concerned us is the part D. I think over the years, that's one thing that you hear a lot about the part D, which is the prescription drug. Prescription drug, a few years ago, was extremely expensive. Now, if you just have Medicare, you don't have a Medicare Advantage plan, well, here's what's going to happen. Because you already have the Part D, all you have to do now is activate it. If you don't activate the Part D on time, there's a penalty. So, but when you join a Medicare Advantage plan, the Part D is automatically activated for you. So you really don't have to do anything. Now, last year, well, let's go back to I think it was President Bush, the son, which passed a prescription drug plan, which in terms, which they call low-income subsidy. But when you get the application, once you turn 65, this is one of the applications that you will get. And on top of the application, it says, help with prescription drug. So that application, once we fill it out, we send it for you. What it does, it pay a portion on the prescription drug for you. Let's say, for example, you have, at the time, if you have, let's take any medication that's costing $100, for example. Well, the plan will pay a portion. Low-income subsidy will kick in and pay a portion. Now, low-income subsidies have different levels. There's level 1, level 2, level 3, level 4. It's based on how much money that you have coming in. In other words, let's say if it's only Social Security, how much money are you getting from Social Security? Whether you're able to get full Medicaid or the lowest. Now, over the year, it has changed because of the increases that has happened in the past couple of years. But the low-income subsidy is there to give you a great help with your prescription drug. Of course, what the current administration have done this past year is that passed another law that provide, for example, insulin, the highest amount that you could pay for insulin is $35. In most cases, those of you that's in a Medicare Advantage plan, what you have seen is your medication have go down extremely. A few years ago, we used to talk about something called a donut hole. We're not talking about donut holes for the past, I think, for the past 5-6 years. We don't talk about donut holes anymore. What the donut holes is, it doesn't mean that it doesn't exist. It's still there. But what your providers have done is find a way to get around that because it was interfering with your care. So the doctor would prescribe you certain medication. And if he's prescribing you brand name, the brand names are more expensive than the generic. So you were allowed to spend a certain amount a year. Once you pass that certain amount, then you get into what they call the donut hole. So at that point now, the cost of your medication will be coming out of your pocket until you reach what they call a catastrophic level. So the catastrophic level now, the plan's going to come back in and pay your medication for you for the rest of the year. So over the year, what the doctors have done and we got your primary care. I think over the year they have done a magnificent job in controlling that aspect of your Medicare or prescription drug. Well, they're starting to prescribe more generic. So the generic, basically, to give you an example of what a generic is, basically is the same medication as the brand. Same company created that medication. After a certain amount of years, I believe it's 25 years, after 25 years, they could go in and create a brand name. They just change a small, they just take out one part of the menu, for lack of a better word, that they, or one part of the ingredient, that's the word I'm looking for. One part of the ingredient, take one part of that ingredient out, and they created the same drug for lesser price. So they're able to sell, now they have two drugs on the market servicing the same needs, one for lesser price, which totally have the same effect as the brand name, and now they're able to sell it for lesser price. It does not affect, it has a less impact on the total amount that you're spending, because now you're spending less on that particular drug. So therefore, throughout the year, you're not going to reach the donut hole. You're not going to reach a catastrophic level, because the medication that you take, whether you're taking 4 or 5, they're generic and they're cost less. Remember, cost is the main factor in healthcare, because obviously if it's something is costing you more, you're not going to take it. So over the years, they have found ways to make it more affordable for you. Now, so this is the part about Medicare, and I'm going to make it more excited, because I'm not getting any calls about Medicare. And every single one of you that's listening to me right now, you guys should have questions. Every single one of you. Because Medicare is going to be a part of every single one of your life. A lot of you that's listening, maybe it's because a lot of you that's listening right now, you're probably not calling because you're hearing me for the first time talking in English, or you have a group of people that's sitting in, taking in the information. And that's good. But the line is always open for you if you have questions to clarify that. Or you could always reach me at 954-667-4885, 954-667-4885, with any question that you have. I'll be able to answer it for you. And a lot of you that is listening right now, you have your parents that's in need of a plan, that's in need of certain benefit. This number, you should lock it in your phone. This number should be a reference. Anything that you need to know about Medicare, about Social Security benefit. So I invite you to do that. Now, for the rest of the time that we have left, the time goes by real fast. Before you know it, it's over. But we're going to talk a little bit about Social Security retirement benefits. Social Security retirement benefits, again, that money comes from directly from you. When you hear people are talking it's entitlement, no, it's not an entitlement. This is a contribution that you've made. I often use the example of baby boomers. Right now, we're closer towards the end of the baby boomers. The baby boomers started, I think, from 1959, if I'm not mistaken, to 1962. So everyone that was born
I think it's everyone that was born within that time, and I'll double check the years. I think it may be a little bit earlier than that. But everybody that was born within that time is made part of the baby boomers. Well, the baby boomers, there was a lot of people. Our parents procreated, and they really stuck to the word in the Bible. They procreated. So they had 4 children, 3 or 4 children. So when those 3 or 4 children got into the workforce, well, now what they're contributing was going to pay the benefits for our parents. So our parents' benefits is being paid for. But as the baby boomers itself is getting into the workforce, there was a surplus of money that's coming into the federal government. So there was no fear of running out of funds. Now you hear from time to time that Social Security and Medicare may not be solvent until 2035. I think that was the last estimate. That doesn't mean that there's not going to be money there to pay the benefits, but until 2035, they may have to either reduce benefits. You see, recently what they did was increase the retirement age. So let's talk about that. What are the retirement age? Retirement age starting from 62. You could take it as early as 62 or as late as 70. Now, when you take your retirement age as what we call early retirement, which is from 62 to 65 to 66, considered early retirement now. Well, when you take it at 62, for example, they give you 70% of that benefit. Now, let me step back because there's always a confusion when I explain it to you this way. What they have to, because a lot of people come back to me and say, well, if they give me 70% of my benefits, well, what happened to the 30%? Are they keeping it? No, they're not. What they've done is they took the last 35 years that you've worked and calculate to come at an amount that you'll be receiving. It's not that they didn't take into consideration the other years that you worked before the 35 years. They've taken all that into consideration to come out to an amount that you'll be receiving. So the amount that you average the last 35 years, they're going to utilize that amount for you to be getting for a period of time, the rest of your life. Now, the person that's taking it at 62, you're taking early retirement, so you're getting it's basically a calculation that they made what 70% of that will represent. Because you're going to end up receiving more checks, about 60 more checks. If my math, well, for some people it'll be 50 more checks, and for some people it'll be 48 more checks. Am I making that math? I'll have to double check the math because off the top of my head, it's about that. So you're going to get 48 more checks on top of what you should be getting had you taken your retirement at the age of 67. So the more you wait, for example, every year that you didn't take your benefit, and we're talking about retirement benefit, it increases by 3%. So every year that you wait, you don't take your benefit, it increases by 3%. For a lot of us right now, our retirement age
is 67 years. You see, recently in France, rioted because of the fact that they their retirement age right now is 62, and the president of France is considering increasing it to 64. And there was a lot of rioting in France. Yet us in the United States, it was 65, and they've increased it to 67. And don't be surprised if down the line that they decided to increase it some more. Because what happened is that we are living longer, so we are receiving more benefits, longer period of time. So imagine that the calculation that they made didn't base on you living up to 100 years. But now you end up living longer. And when you see the people that, this generation that's living, when you look at them, the 50 years old, the 60 years old, they say, well, the 60 is the new 50. The 50s are the new 40s. So you are living longer. I think the medical industry has made great stride in great advancement in research, how you eat, the exercise that you do, keeping yourself hydrated, and all that come into consideration on you living longer. So you're receiving benefits longer, and that's one reason why that you right now that are receiving benefits or that's going to receive benefits, and that's the main reason why there'll be a shortage. Plus the fact that there's not as much people after the baby boomers. There's not going to be that much as much people paying into Social Security. However, where we're going to receive some help is the immigrant that's coming in to the United States, that's working into the United States, that's contributing to Social Security, and that's where they're going to receive the help that they need, or we're going to receive the help that we need, because at the end of the day, we're going to get to that point and we're going to receive the benefits. Well, we're going to stop right here. It was definitely a pleasure to do this show. I want you to go to WSRF 1580 AM. And right now we are being broadcast live on both YouTube and Facebook. And I recommend that you not only watch it, make use of this information we just shared with you, but subscribe. This show comes to you live, and you could also replay it on YouTube and maintain that information. So go to subscribe to this. So every Wednesday when we come back on, you'll have that information. You'll have new information. We'll be talking about, we're going to be talking about Medicare and Social Security. Next time we'll get into Medicaid, because one of the things that I was having a conversation with a young lady earlier, and a lot of you are being impacted by Medicaid because of some law that they have, the COVID law that they had. It's set to expire, or it already expired. So a lot of people, Social Security, Medicaid are being impacted. So there's a lot of work that we have to do in order to make sure that you that have Medicaid, that your Medicaid is still active. Well, it's a pleasure to be with you guys today. My name is Gilbert Franklin. You could always reach me at 954-667-4885, 954-667-4885. Stay tuned for the next show, which we're going to be concentrating on the medical aspect of it. It'll be in Creole. So come back and please enjoy it. and we'll be talking in a little while.
Let's say it together. There is power in the name of Jesus. There is power.